or something like that? Okay, let me see what the chat says. Yeah, okay, cool. You guys can hear me. Great. My name is Chime Sonye. I am the founder of Nigerian Mental Health, and I'm so honored to welcome you to this great conversation that we're going to have today, where we're going to launch a very important conversation, which is around the connection between mental health and elections. And something that we don't usually discuss, something that we don't usually connect with. And the video you guys just watched is some of the work that Nigerian Mental Health has been doing in the mental health landscape, focused on decriminalizing attempted suicide. We'll talk about that a little bit more at the end, but it's just to continue to create awareness around the issues and the challenges we continue to face in Nigeria. As we start our conversation today, I would love to acknowledge many of the partners that made this possible. Um, we got great data and reviews on this work from organizations like Enough is Enough, as you can see represented with the Office of Citizen RSVP, from Yaga Africa, which did yeoman's job when it comes to inclusion of marginalized communities within the mental health landscape, and of course, our critical partners, which is Leap Africa and the Nigerian Youth Futures Fund, which is trying to enhance youth participation to really create the future that we want in this country across a variety of thematic areas. Today, we have a really important conversation that we're going to be holding with different political officials. Um, we'll hopefully all of them will be here. We understand it's the 1 year anniversary, and there's certain responsibilities or challenges that they may have to make it today. So if one or two of them are not able to talk, we apologize for that in advance. So I want to talk to you guys so you understand a little bit about what Nigerian mental health is. Nigerian Mental Health is a global community of mental health practitioners and persons with disabilities. It says 30 mental health organizations, but now we have over 40 plus organizations actively leading efforts to improve psychosocial well-being, both in Nigeria and in diaspora. We were founded in 2019, so about 4 or 5 years old, and we were trying to connect and strain the mental health community in the country, focused on our community of practice that brings individuals together. We have um, four core objectives. One is to connect Nigerians actively focused on advancing mental health. It's really a challenge working in this space, whether it's funding or whether it's the lack of governance. So making sure that we can get together, connect, and use our human resources to support each other's efforts. The second is amplifying and strengthening individuals' efforts on mental health related issues. We have different organizational events and activities, and we can draw expertise from people within the network for the things we're doing, or resources if necessary. If somebody needs a psychiatrist, if somebody needs a specific intervention in a specific part of the country, they can draw on Nigerian Mental Health in order to work on that. We want to increase awareness and knowledge of resources focused on Nigeria, Pan Africa, and diaspora mental health. We often share resources, and that could be funding opportunities, that could be things that are going on right now. For instance, one of the things that the World Health Organization just announced is climate change being a key part of its pillar for the next couple of years. And there's a core connection between climate change and mental health. Sharing that information on our platform allows individuals to use it, whether programmatically, apply for funding, or in order to concentrate their efforts. And then fourth, conducting programming focused on transformational and sustainable change in Nigeria's mental health landscape, doing things like helping pass Nigeria's Mental Health Act that we helped in 2022, or helping co-author two national strategies when it comes to mental health. And then finally, we have different areas programming, which involves in policy advocacy, uh, kind of what we're working on right now in terms of trying to mainstream mental health and psychosocial wellness within mental health programming. Second is data and information gathering, doing research and information on different areas of mental health in the country to make sure we fact check and make sure we have the right evidence in order to do different interventions. Third is wellness, which involves different type of programming, especially focused on things like our community wellness practices, where we have candles or yoga or different things that really utilize the body as a means and site of mental health support, and then wellness. Then disability inclusion, which is not mentioned here, which is really understanding that mental health is a feature of disability. Actually, according to the World Health Organization, is the largest cause of mental health conditions. So it's something that we have to continually connect. If we think that people with physical disabilities need accommodations, then obviously another type of disability in terms of mental health, those individuals are also going to require accommodations as well. So what are our core objectives today? They're really threefold. Some of you may not be aware that May is actually Mental Health Awareness Month. So this whole month, people within our organization and people all around the world have been doing activities related to Mental Health Awareness Month. For instance, in America, the government launched a new suicide prevention 10-year strategy in relation to that. Other countries have launched other initiatives. So to honor this month where we're supposed to put mental health and wellness at our forefront, we want to have this conversation around elections and mental health. The second is that it's very strategic at this point. We are commemorating the 1-year anniversary of Nigeria Decides that happened last year, and also the intake of this administration. So we want to continue to prioritize mental health and how policies will be conceived and thought of going forward. And then the final objective is to share our evidence-based research based on mainstream mental health and elections to launch this policy brief so people understand that there is a connection between mental health and the elections. And so we need to focus on that. And the focus can't just be personal, but there's actually rules, regulations, policies, and laws that can help create the enabling environment so people can prosper when it comes to mental health and the elections. And just to give a little bit of an overview about how today will go, we'll have goodwill messages from our core partner from Leap Africa. We'll have our featured remarks from our political officials that give us a sense of how do mental health and elections, what is the interplay? What is our understanding of the connection of the two? What is their recommendations for individuals like you, young people, old people, in terms of thinking about mental health in the elections? And why is mental health even a priority that policymakers should consider when it comes to their jobs and responsibilities? After that, we'll formally launch our policy brief. Elizabeth Ita, our program being official in Nigeria Mental Health, will give a discussion that goes through the state of mental health today when it comes to mental health in the elections, that goes through some of the challenges when it comes to mental health and its impact on the elections, and then finally some recommendations moving forward. We'll have a group picture to commemorate the event, and then we'll open up the field for questions and answers for anybody who's curious about the policy brief or the remarks from our political officials. And so with that said, I'm going to invite our honorable distinguished Oga from Leap Africa to join us on stage. Ikenna, are you there? You can unmute yourself.
Hi, Chima. Thank you very much. I'm here. Let me know if you can hear me and probably can see.
Yeah, I'm about to pin you. Perfect.
Just introduction to this conversation. I'm quite excited to be here and very excited to see how to brief as well. So my name is Ikenna. Like my friend Chima has introduced me, and I'm the. So NYFF is a 5-year community group, and the idea of the project is to resource the agents to keep doing the activism and sustain the work that strategy is to decentralize access to funding. That means that we want to ensure that every of Nigeria and the FCT, CBOs, CSOs have access to technical capacity building and the network to grow at the same time. So that's about NYFF. So if you want to know more platforms, NG_Youth Fund on Instagram, ORG via web to also understand more about that piqued our interest. Nigerian Mental Health is a partner to work they do around mental health, which is really novel in Nigeria, and they need to. Our partners are quite interested in mental health, especially as it has to do with young people. In comparison to elections, you see that the fronts of elections are always young people. We have almost 50% of the Jabba syndrome. You see that and you see that many people give up, or believe as they really make people want to migrate, or the divide we have during election, the political divide, ethnic divide, actually born out of elections. So you'd see, take away elections from the conversation, divides and a polarized nation like we have right now. So it's really important to think about how to mainstream elections to our electoral process. Nigerians, young people are AFCON match that the AFCON 23, right? That just happened a few months ago, and how young people were actually even a few people because of the patriotism to Nigeria. So that is something that we can them. They want to migrate, or they want to, pull out from the conversation around Nigeria. So we mainstream mental health to elections so that we can ensure that post-election and still contributing to national development. So on this one, the whole team, also thank you to the speakers who have agreed to come have this conversation and we're looking forward to the launch of the policy brief electoral process. But thanks so much, and I'm happy. What you, Chairman?
Ikenna, thank you so much for that, for those words. Very important for people to understand what Leap Africa is, what they're trying to do, and also the Nigerian Youth Futures Fund that I would encourage all you guys all to check out and see the areas they work in and how you can potentially be involved to get supported in trying to have the vision and the future that we want for this country. And this is really important conversation to piggyback on Leap Africa, is because a lot of unfortunate young people felt that maybe the electoral exercise didn't go how they wanted to be, whether the candidate didn't win or whether they felt disenfranchised in terms of going out to the polls, or they faced other economic hardship challenges that made electioneering not the most important priority. So this is a critical conversation, not just for the general electorate, but especially young people. And so we appreciate Leap Africa for its generous support in making this possible, along with our other partners. With that said, we're going to pass it to our very distinguished, honorable Akin Rotimi Jr., who's the speaker and spokesman at the chairman, as a chairman of the House Representatives Committee on Media and Public Affairs from Ekiti State. As long as I've known Honorable Rotimi, he's been a proud champion of not only young people, but also of mental health. And so it's very important for him to talk about what he thinks the connection between mental health and elections are, why he thinks that mental health is important, and give us some words about maybe how his tenure has been 1 year in office. So, Honorable Representative Rotimi, thank you so much for entering our virtual stage.
Thank you. Thank you, ladies and gentlemen. Just a slight correction. So my name is North One Federal Constituency, and I'm the spokesman of the House. As the presiding officer, but I'm the spokesperson of the House, and I chair the House Committee on Media and Public engage, with it in this conversation. Thank the organizers that put this together. I'm a proud LEAP alum. The issues around mental health, yeah, and not just on this issue, but so many other issues that we always have, when we consider where we are in, fail to realize that though we have a long way to go, we have indeed covered a lot of ground. Mr. Chime rightly said, the issue of redressing legislation. I mean, we had something even called the Lunacy Act. That was what Act was enacted in 2022. So we have come along understanding the issues. One interesting aspect of the Mental Health Act Assembly is the fact that it equates, and I'll just read something very quickly. A person with a mental health is entitled to physical health challenges, which is really fundamental and really because once we begin to understand that someone with a mental health challenge, even though it's not someone has, has an ailment physically, it's easy to be able, even though mental health issues are difficult to identify and diagnose and properly see to sufferers, require and deserve as much beauty of care as people with physical ailments. Now, looking at issues around relating to issues of mental health. First of all, we have a legislative agenda, and I would like to encourage everyone. Culture of lamentations without, making the efforts to engage the process. We recently had a retreat on the constitutional review, and after several calls for memoranda, we had only 305 amendments, only 305 out of 250 million Nigerians. That says our lamentations are not leading us in the direction of know that we have a legislative agenda. And please look out for it. If you want, the organizers I can share with them attendees at this meeting so that we can first what we're doing and what we intend to do in this and issues around mental health. So first of all, there is an issue in our agenda 6. It clearly states there that gender mainstreaming, prohibition, civil rights, and so many other things. In terms of also prioritize improving access to primary health care services, particularly you would see again that primary health centers are supposed to be at the front line of, at that level, that understand the signs and know the proper responses, then would have a long advertising, access to universal reforms, and also issues around psychosocial care for survivors of sexual and gender. There's a strong nexus between people that have faced some sort of sexual issues around mental health. So there are so many other areas that we can talk about elections. Like I said, we have elections. We know that election periods are very, very stressful periods. I know that as someone that has been involved in someone supporting other candidates, and in this last election, I was, contesting for office, and I remember how that in 20 I had a breakdown. I actually shut down, you know, and at that time, thankfully, I'd recognized the sign, stress and pressure. If you're someone in public office, you can understand what it is to be an empath that does too much. And I actually had to travel for some time. And for about 3 weeks or so, I was now. I could not open a laptop. I could not do anything. And it got to the stage I was even considering, and I'm saying this for the first time, at that point, I writing to tell my party that I wasn't interested in going ahead with it. It was that bad. And I at that point in time, I realized just how I could empathize those sort of challenges. And I know it took me a whole lot to get through that point. At a point in time, I had to speak with someone because I started to understand issues around fight or flight, someone and actually talk through these issues to help me disaggregate issues and really help me put a structure around all that I was doing. Essentially, particularly around the nature of Nigeria is that we like to just put all the pressure on our leaders, you know, without so for me, I know what it is firsthand, you know, the pressure that elections puts on not only people contesting, but even people inciting violence and, you know, exacerbating, you know, our fault line and all of that. So there's a whole lot. And I don't blame anyone that takes the position that, look, I'm not ready for watching African Magic. I don't have time for all of this. You know, the amount of violence and all sorts of things. So these are, when you talk about mental health issues, ensuring that things are as simple as possible, campaigns, I think that long before elections, we should have more sensitization. Before you have a lot of disinformation and all of that, there should be sensitization to make it sort of easy for process. Let them know what exactly is going to happen, even including the process of day of voting. That's number one. There's also the issue of training of election officers. I think it's important that not only civil society actors that are elected, people like uniformed security agencies, INEC themselves, and everybody these issues and look out for signs. In other jurisdictions, I know that they're doing more, they're taking more, teaching their security agencies to be able to respond to issues. You might have someone demonstrating some sort of weird behavior. And because of how tensed political environment and elections are, you know, very drastic actions that have led to loss of lives and property. So it is important that training of election officials, you know, happens. Then also accessible voter education materials, different, you know, capacities, not only those that are visual, also those that have one sort of mental health challenge or the other. We should be accessible. We should make it accessible. And also issues around accessible polling. We should be able to take people through these issues. I, for one, am very big on inclusion. I'm one person in every single ward in my constituency that represents people with disabilities. So I'm very big on it. And increasingly, I'm seeing that also people with different forms of mental disabilities that in terms of accessible polling stations. And also in relation to that is reasonable accommodations. If you know that somebody has had some mental health is not necessarily like, oh, this person is gone crazy. Like, it might be that the person just went through a traumatic incident. You know, some sort of traumatic event. It is for stakeholders around there to say, look, let us accommodate these people to go first, to go ahead, so that we build no one behind. And then last but not least is in terms of issues of support services, protections and rights. There's so many issues to be able to look at. And I think that all stakeholders need to prioritize, so that we have a truly inclusive environment. And I'll just end with these points that I made. That anxiety around the elections and all of that. And I know what it was. Travel long hours on planes, 13 hours, 14 hours. I remembered when health breakdown. I couldn't imagine even being in any closed, claustrophobic area. Well, thank God all of that, was just a passive phase. It's gone. Lagos to Abuja some time ago. And then there was this lady, it was one airline, and a woman was hot, everywhere was just, and the lady got, really, yeah, I want to get out, because the plane had been shot, but it was taking the runway. She was screaming that I want, to everybody was just, even the airline staff and the pilot, everybody was just like, some were even laughing. Some were like, "Madam, sit down. What's your, my own lived experience, I had to go meet her and then spoke with her. And then some of the skills that I had even to it and trying to ground her and, a lot of things, that I really helped her to really calm down. She came back. I had to sit with her, almost through the flight. And we got into a very interesting conversation. And she told me all of her experience is that a lot of people, right, don't have a clue about these issues. And that's why we have left many people behind. Understand that. And the final point, permit me, as a politician, we are in at least 3 times. So this will be the last one. I think that particularly primary healthcare facilities should have inclusions, right, for, with mental health. I think that we need a lot of education, and this is something that should even be situated with system where there's counseling. If somebody is just feeling a lot in Nigeria at this point in time, sometimes people just need someone to talk to offload and just engage. Train to recognize signs before it gets to points of people being even suicidal. And even if there are people that are suicidal, how to yourself, you're just trying to, and all of that. And we get all of that. I won't lie to you. We get a lot of that. People come to me, I'm depressed. I want to kill myself because he wants to collect money from. What do? We need more people that understand the issues, that can address the issues, and can pass my power. How do we get someone from within the community, either a religious, someone that they can talk to be able to address this issue? So overall, we have a lot of work to do. I'll be very, very happy to actually even look at proposals that you have. I would redressing some of these issues and bringing up some of this legislation and some of the amendments that are necessary. The Mental Health Act, as we know, needs areas of improvement here and there. Issues around decriminalizing, suicide. There's evidence around it that it's necessary that we move away from those directions. But remember as well, before we throw the baby out to the bathwater, that the intendment of some of those laws was actually to discourage, if you know what I mean, people, otherwise, young people with their lives ahead of them, taking their lives and all of that. So we need to find that balance. Yes, it's been decriminalized, but at the same time as well, we hold a duty of care as a society to sufferers of one type of mental health challenge or the other, that, look, this is an empathetic society. You're going through something tough. Either but society will not let you fall through the cracks. Even if you attempt suicide, you have society to fall back on. It's not going to mar your track record. So, for example, someone attempted suicide, and therefore the person can't run for office again, or can't do other things, can't access certain jobs and privileges. Society that means well for its people who do all of that. So the 10th Assembly House of Representatives, and I promise you this is the last point, the 10th Assembly House of Representatives is the people's house. People say all the time that, oh, as spokesperson, you're very engaging, you like to engage the public. I say, look, just one of many. We have many young people in the house, many issues that are very involved in taking conversations on key issues forward. So please use us. When you have your drafts ready, we are ready to advance those issues. Thank you very much for having me speak.
Thank you so much, sir. And please don't go anywhere. We want to take a group picture with you after we do the presentation. But there's some things I wanted to, and there's some questions that I wanted to ask, and I'm sure the audience may want to ask you. You said you're the people's house, and I'm sure you have more points to share with us. So I'm gonna just say that just some things you mentioned already in terms of, you mentioned agenda item number 6, talking about mainstreaming gender and other issues. So that means, A, there's an agenda. We don't have access to that. That'd be amazing to get access to that so we can use that for our advocacy efforts and also connect with you. And then also, you made some amazing recommendations about the things that we should have, whether it's training of electoral officials, support services in terms of accommodation, decentralizing these efforts. And so we want to take your recommendations and make sure we put them in our proposal before we share it publicly, because it would be great as someone who has this lived experience to incorporate that into the policy document so people have that lived experience, and we can share it with you as well, so we can continue to push. And then the final thing I will say is that you mentioned lived experience being very valuable. I think that's so key. There's nothing about us without us. So in these conversations where decisions are being made on behalf of persons with mental health conditions, some of us should be there so we can be part of that conversation, so we can be part of that discussion. And so we know that you as a people's champion will help be our link, so to make sure that we're in those spaces. So we're really excited to work with you going forward. And we hope that as you hear about the policy document, that you'll get some ideas, but we'll make sure that we continue to connect with you and work with you going forward. Thank you so much, sir. Can we give him a round of applause?
Thank you.
Can we give him a round of applause, guys? Virtual round of applause.
Chima, would you want me to? Thank you. Thank you very much. Chima, would you want me to respond to that real quick?
Sure, you can respond to that, but there's other people that are going to have questions for you as we finish, but you can respond to it now, sir.
Okay, so very quickly, I'll share the agenda with you. It's very important, because anybody looking to collaborate with the People's House, the House of Reps, it's helpful for you to align and show an alignment with our agenda. That's number one. Inclusion of voices of different participants, key stakeholders. Any law that's going to be enacted or is going to be updated of a public hearing, right? So again, we can follow through with that so that we can have more people in the room, through that process. If we're looking to, there'll definitely be a public hearing, and it's good to be able to engage. But again, I will say it again, that we need more people. Who is the person representing you? Who is your senator? If people don't know that and they're screaming it, do you understand what I mean? So we need more engagement. We are the ones actually saying that. So, engage with us. Yeah, so
yeah. Thank you so much, sir.
But I'll take other issues.
Yeah, so we already have questions for you. But before we have people already asking questions for you on the chat, but before we go to questions on the chat, we're going to move on to actually launch the policy brief. We wanted the Minister of Youth to be able to discuss, but we understand because it's the 1 year anniversary that she's been pulled away, unfortunately. So, and we got so much from the Honorable Rotimi anyway that we can soak on and digest. So let's get into the policy brief conversation. And with that, I'm going to call on Elizabeth Ita, which is sorry, I'm going to call on Elizabeth Ita, which is the program representative for Nigeria Mental Health, to really share details on the policy brief with us. Elizabeth, are you there?
Absolutely, I'm here.
Okay.
Thank you so much, Chime, for the opportunity to share. Good evening, everyone. It was an absolute pleasure to listen to Honorable Akin speak. He said lots of things that resonated with me, and I trust resonated with everyone here as well. Can everybody hear me?
Yes, we can hear you.
Okay, lovely. I just wanted to confirm. Okay, so thank you so much once again for joining us today as we discuss an important issue, which is mainstreaming mental health in elections. I'd like to kick off this presentation with the state of mental health in Nigeria. So, Nigeria has, recently witnessed significant strides in mental health, reflecting a growing recognition of the importance of psychosocial well-being in national development. But currently, state of mental health. Mental health is a global concern due to its widespread prevalence and profound impact on individuals and societies worldwide. The Global Health Data Exchange from 2019 showed that 1 in every 8 people, or 970 million people around the world, were living with a mental health condition, with anxiety and depressive disorders being the most common. Currently, in Nigeria, only about 200 psychiatrists serve over 200 million people in Nigeria, which is 1 to 700,000. Meanwhile, the standard practice is for one psychiatric doctor to care for 10,000 patients. So see 1 to 700,000 as against a standard of 1 to 10,000. So it's a very dire condition and situation that we see with regards to mental health in Nigeria. So despite all of this, Nigeria has made notable progress in addressing mental health, underscoring a growing recognition of its critical role in national development. So in March 2022, the Federal Ministry of Health launched the National Mental Health Program, which was an initiative created within the Non-Communicable Diseases Framework and backed by various stakeholders. It represents a foundational shift towards prioritizing psychosocial well-being in the country. Moving on from there, a landmark achievement in this journey was the passing of the Mental Health Act in December 2022. This law safeguards the rights of individuals with mental health conditions and ensures their access to quality care and treatment. I'm proud to say that Nigeria Mental Health was instrumental in advocating for this act, mobilizing support through an open letter to the president and legislative leaders signed by 40 mental health organizations and professional associations, amongst other advocacy activities carried out. Further strengthening the mental health framework, Nigeria launched the National Suicide Prevention Framework and the National Mental Health Policy in November 2023. These comprehensive policies provide strategic roadmaps for promoting mental health, preventing suicide, and supporting individuals at risk through evidence-based interventions and community collaborations. So I'll be talking next about the current state of the Electoral Act. And so despite these achievements, there indeed is a critical need to adopt an intersectional approach to mental health. especially in the context of elections. So currently, the Electoral Act lacks comprehensive provisions for individuals with psychosocial disabilities, unlike the more established measures for those with physical disabilities. So there is a clear gap here that represents a critical challenge in ensuring an inclusive and equitable electoral process for all citizens. This gap is clearly shown on the slide on the screen. So you can see that there's provision for accessibility features at polling stations like ramps, parking. There's provision for assistive devices like braille ballots, magnifying glasses, and easy-to-read voter information. And then there's clear guidelines on accommodating voters with physical disabilities. But there is a very clear lack of provision for psychosocial disability. So there's no clear definition of mental health conditions or mental incapacity, which could limit one's ability to vote or not. There is no specific measures to support voters with mental health conditions. There is the absence of mental health services or support mechanisms during the electoral process. And there's inadequate training for electoral officers on handling psychosocial disabilities. Next slide, please. So why is this important? Why are we having this conversation here today? Moving on to the next slide, we can see snippets of very, troubling media features concerning the elections. Elections are one of the most fundamental elements of a representative democracy due to its significance in the leader recruitment process in a democratic system of government. However, elections are oftentimes accompanied with extremely unpleasant events. And I'd like to kick off with some data on the next slide. So the first problem we see here is the exclusion of people with disabilities. And so after, looking through and evaluating election observer reports, these are some of the data that we've been able to glean from those reports, and I'll be sharing in the next few slides. So for exclusion of people with disabilities, one of the data we gleaned, from the observer reports was that in 54% of the polling units observed, the polling presiding officers recorded people with disability voters on INEC form EC4OH, while in 21% of the polling units, they failed to do so. It was also found that in 14% of the sample polling units observed, there was non-deployment of the form EC4OH by INEC, and in 11% of polling units observed, there were no people with disabilities present for the polls. Now, regarding the proliferation of hate speech, YAGA Africa defines hate speech as the use of derogatory language to incite violence against a targeted group. In their Watching the Vote Third National Pre-Election Observation Report, YAGA shared that 4% of their observers witnessed, while 5% heard hate speech against candidates or people because they are women. And these were observed as follows. So 11% in the North Central, 15% in the Northeast, 4% in the Northwest, 11% in the Southeast, 7% in the South-South, and 5% in the Southwest. And then 3% of observers witnessed, while 11% heard hate speech against candidates or people because of their age. And this was reported as follows. So 13% in the North Central, 18% in the Northeast, 18% in the Northwest, 12% in the Southeast, 11% in the South-South, and 5% in the Southwest. So hate speech was one of the recurring themes in the observer reports. And then there's the underrepresentation of women, youths, and people with disabilities. And so the presidential elections featured 17 male candidates and 1 female candidate. There were 93 million registered voters nationwide, but 47.5% of them were women, according to INEC. There was also low representation of women as election officials, serving in the capacity of INEC ad hoc staff, security officials, and party agents. Electoral records that in up to 20% of observed polling units, there were no female INEC officials. There were varied cases of gender-based violence in 5.3% of the polling units observed, and Electoral also observed that in 6.5% of the polling units, wasn't very secure for women. There was also an instance of physical assault in one location observed, and 4 cases of non-physical or psychological violence observed. We also have, recurring themes of electoral violence. And so for the just concluded 2023 general elections, data gathered by the Council on Foreign Relations showed that 38 people were reported killed across Nigeria in February owing to election-related violence. According to Human Goal, election-related fatalities represent 15.4% of the total civilian death toll recorded that month, which was lower than the records from the 2019 elections. Yaga reported that at 6% of polling units, the observers reported that voters faced intimidation and harassment or assault, as well as situations that were likely identified as voter inducement. At this point, I'll be speaking on some of Nigeria's election challenges from our analysis of the observer reports and how they impact mental health. And so we saw logistics and preparation challenges, problems like PVC collection difficulties and relocating voters to new polling units, which hindered citizens' ability to engage in the electoral process, leading to frustration and disengagement. And then, of course, there were security concerns such as insurgency, banditry, and general tensions, which created a pervasive sense of fear, anxiety, and uncertainty among voters. Then there were the operational and technological challenges regarding the use of the BVAS devices, causing significant frustration and anxiety on the election day. Then, of course, economic hardships and voter trading. So there were economic challenges like the fuel scarcity and then the financial strains from policy changes. I think that was around the period of the Naira redesign, which led to heightened stress, anxiety, and emotional distress among the populace. At the next slide, we'll see that there were communication and information gaps as well regarding polling unit relocations and PVC collection, causing confusion, panic, and potential voter disenfranchisement. Then there was violence, insecurity, and election-related stress. So insecurity from armed groups and political thugs, along with uncertainty about election outcomes, significantly increased stress levels amongst the citizens. Then there was voter apathy and low turnout. And this created feelings of disillusionment, dissatisfaction, and disengagement among the electorate. There was observations on the lack of representation of women in certain electoral roles, raising concerns about gender equality and representation, and also contributing to feelings of marginalization. On the next slide, we'll see reduced trust brought on by the lack of transparency in the electoral process, especially during result collation, which bred anxiety and distress among Nigerian citizens. There was information and disinformation and media coverage. So the spread of disinformation, especially via social media, and then the negative media coverage, and then hate speech propagated on social media, heightened public distress, leading to a more anxious and polarized populace. And then finally on this list, stress and psychosocial impact on candidates. Candidates, especially those facing legal disputes or procedural issues, experience prolonged stress and ambiguity, which I believe significantly affected their mental health. And then the last two are social media impact. leading to feelings of isolation, anxiety, and distress amongst those people targeted, and then electoral dispute resolution. We all know that after the elections, there was a legal process around it, which created prolonged periods of stress and anxiety for both the candidates and voters, which impacted mental health due to sustained uncertainty and tension. Now, these challenges I've listed highlights the critical need for intersectionality in addressing mental health within electoral processes. And so by mainstreaming mental health considerations into election planning and execution, we can better support the psychosocial well-being of all participants and foster a more inclusive and equitable democratic environment. In light of all this, Nigerian Mental Health, in collaboration with stakeholders like Enough is Enough and YAGA, and funding partners like Leap Africa and the Nigeria Youth Futures Fund, are launching this policy brief on mainstreaming mental health in elections. And so I'll be sharing our recommendations in the following slides. The first is increased mental health support services. And so we are advocating for the provision of mental health support services like hotlines and counseling centers, specifically tailored for individuals affected by election-related stress, anxiety, or trauma. There is currently a government-sponsored national emergency hotline, 118, that could serve. INEC could also partner with mental health professionals and disability advocacy groups to develop resources and guidelines for supporting voters experiencing election-related stress or trauma, and ensure accessibility for those with psychosocial disabilities, to include materials in easy-to-read formats, text-to-speech, etc. And then the second recommendation is trauma-informed care training for election personnel. And so it is our recommendation that the government, INEC, provide training and resources on trauma-informed care to election officials, electoral stakeholders, including election officials, party representatives, security personnel, and volunteers involved in the electoral process, to equip them with skills to recognize and support individuals experiencing election-related stress or trauma. An example of this is the United States, which for the first time is conducting mental health and stress trainings for staff in their 2024 elections after the chaos of their 2020 elections. The third recommendation here is to integrate mental health considerations and promotion of inclusivity in electoral planning. And so we are encouraging INEC to integrate mental health considerations into their planning processes to ensure that elections are inclusive and accessible. This involves addressing logistical challenges, providing accommodations like accessible polling stations, ensuring clear and accessible information dissemination, and minimizing factors that contribute to stress during elections. By doing so, electoral processes can facilitate participation for individuals with mental health conditions or disabilities without any additional stressors. Our fourth recommendation is on policy formulation and implementation. And so we're advocating for the formulation and implementation of policies that prioritize mental health considerations during electoral cycles. And so we're also advocating that policymakers and candidates integrate mental health provisions into their manifestos as well, which is something that we did not see in the manifestos of the candidates in the last election. The current Electoral Act has mainly provisions for people with physical disabilities, like we said. And so in terms of policy formulation and implementation, we're also advocating that INEC expand disability provisions and broaden them to specifically include psychosocial disabilities alongside physical disabilities. This will ensure that all voters facing potential barriers due to their mental well-being have access to the electoral process. And then on this point as well, we have voter education with mental health and psychosocial disability considerations. And so we're also advocating that INEC develop voter education materials that are clear, concise, and easy to understand, considering the needs of voters with cognitive difficulties and those with mental health or psychosocial disabilities. Also offering voting information in multiple languages and formats to cater to diverse learning styles. A case study of this is Australia. And so regarding training, the Australian Electoral Commission conducts training programs for its staff to assist voters with disabilities, including voters with psychosocial disabilities. They also have under finding polling places and accessibility details, they also have a feature that allows people with disabilities locate nearby polling places and filter results based on available disability support. They also have detailed accessibility information for each polling place available upon selection. They also provide assistance at polling places. They have text-to-speech pens. They also provide secure telephone voting. So individuals can vote in secrecy via secure telephone voting from any location, including their homes. They also offer mobile voting. So mobile polling teams can visit various facilities and remote communities during the early voting period. They also provide simplified education activities, so self-paced online education activities in easy-to-read formats with audio captions for people with disabilities as well. On the next slide, which is our fifth recommendation, we have election-specific self-care resources. And so through this policy brief, we're calling on INEC, mental health organizations, the Federal Ministry of Health, professional associations like the Association of Psychiatrists of Nigeria, and nonprofits to develop and disseminate election-specific self-care resources, such as toolkits, online guides, or mobile applications that could offer practical strategies for managing stress, promoting relaxation, and fostering emotional well-being during elections. At Nigerian Mental Health, we also launched a guide to managing election-related stress, which is something that you can find on our website, www.nigerianmentalhealth.org. Our sixth recommendation would be a clear definition of mental disability. And so we're calling on lawmakers to ensure that the definition of mental disability in electoral laws is precise. Now, this definition should include specific criteria to determine whether an individual is mentally disabled, supported by medical and judicial assessments, rather than subjective judgments by electoral officers. It's important to ensure that people with mental health conditions can exercise their rights to vote. And here's how we think that the Electoral Act could be improved in that line. The first is clear definitions, right? And so for mental health conditions, we are advocating for the inclusion of a definition based on a standard diagnostic manual used by mental health professionals like the DSM-5. And this clarifies what conditions are covered. The second is mental or psychological incapacity. And so we're advocating for a focus on the inability to understand the voting process, not the mental health condition itself. This will ensure that people with mental health conditions aren't automatically disenfranchised. So what this means is that the fact that someone has a mental health condition doesn't mean that they do not understand the voting process or know who their candidates are. And so it would be unfair to exclude them from the electoral process based on our judgment of the fact that they are people living with a mental health condition. Our last recommendation is to raise awareness and education. And so we're calling on the government and other stakeholders to launch comprehensive awareness campaigns to educate the public about mental health issues, resilience strategies, and available support services during electoral processes and periods. Now, this includes disseminating accurate information, debunking myths surrounding mental health, and promoting stigma-free discourse on mental well-being within political contexts. Now, having shared these recommendations, I'd like to pass back the mic to Chime. Thank you so much for listening.
Thank you. Can we give Elizabeth a round of applause for sharing some of those really interesting insights about what the current state of mental health is, what the challenges are, and how mental health impacts, electioneering impacts mental health, and also the recommendations. And with that, I would like to invite our our honorable officials, our speakers, our goodwill messengers, our partners to come to the stage. So I know that the head of Enough is Enough is here. If you can put on your camera and come to the stage. Ikenna from Leap Africa, I know you're here. I know Honorable Rotimi. If we can just come on stage and take a virtual picture to commemorate this event. So all the media you guys, please, the media should leave us relax and allow our distinguished panelists to come on stage. Yemi, are you there? Ikenna, are you there? If you guys could turn on your cameras so people can, there we go. And Yemi, if you're there, if you can turn on your video.
I'm here, but unfortunately I can't. Not feeling very well, so my face is quite puffy. So I'll pass on the picture.
No problem.
Thanks.
Elizabeth, how about you? Can you come on or no?
Sadly, no.
Okay. Well, it is what it is then. So I'm gonna try. I tried to add the pin, and I don't know if it works. Let me. What's the best way to do this?
Remove the slide for one.
Yeah. Okay. Okay. You said you can't come, so I will put Ikenna back on. Cool. Okay. And I'll just for the
before
sake of
you
argument,
do the picture, put Elizabeth on. So let there be a gender balance also. So it's not 3 men that we're looking at. So let Elizabeth turn it.
I asked Elizabeth to join. Elizabeth says that she can't.
Oh, did she?
Can't
all right,
us.
I missed that. Sorry.
Yeah.
Sorry.
So I don't know who wants to. Elizabeth, this is your time to shine, though. I don't understand. Is there really no way you can come on for a second?
I could.
Okay.
Just give me a sec.
You've been called out by Madame Patapata from Enough is
Yes,
Enough.
I have been.
So if you're in your row, please just 2 seconds and just so we can get a picture commemorating this event. Does that mean you're coming on? I don't know.
Yes, I am.
Okay, we should just give you a minute. Well, while we are giving you a minute to come on, and the fact that Yemi from Enough is Enough, the executive director, is here, can we, Yemi, can you mind sharing a goodwill message quickly for the audience on behalf of Enough is Enough and this policy brief launch as Elizabeth comes on camera?
Perfect. Thank you. Again, my apologies, one for joining in late and one for not being able to show video. Honorable Rotimi and Ikenna, good afternoon. It's quite a pleasure that this is happening. Let me not say pleasure. I think it's a good thing. Pleasure kind of makes it. Anyway, it's a good thing that this is happening as we continue to move the conversation forward. Excuse me, around the circumstances of our elections and also around ensuring inclusivity in Nigeria. We're celebrating 25 years of continuous democracy in Nigeria. For a lot of Nigerians, democracy and elections are synonymous. Democracy is not elections. Elections are part of a democracy, but they are synonymous. And I say that because elections carry so much weight in terms of not only the players on the politician side, but also on the citizens' part. Those who choose to engage, those who choose not to engage for a variety of reasons. And what for me is important about this policy brief is the fact that it allows us to focus on the two very distinct areas or classes of what I would say is around mental health. When Honorable Rotimi was speaking, he said that people would come to him asking for help. And in a sense, almost, some might be true that they're so tired that they just want to give up. Some might use the fact that they say that as a way to kind of twist his arm into doing something. Now, mental health as a state of health is now being talked about a lot more in our spaces, which is a fantastic thing, because in the past, it's not something you just were expected to just suck it up and keep it moving and deal with it from a cultural perspective as well, and just from a place of lack of understanding. So I think it's nice that it's now becoming part of our language, part of our understanding. And with that also comes the responsibility of being able to manage it so that it's not abused. For example, the example Mr. Rotimi gave, because again, we've seen it in schools where students, to get out of work, they will talk about, their mental health, their mental health. So we need to be very mindful of that in that regard. Number two, we're very cognizant of the fact that the violence that gets unleashed during our elections does affect people. It prevents people from coming out as a starting point. And when people do come out, the effects of it on them for days and years after is significant. And I use the case of the wife of the Labour Party candidate, I believe it's in Anambra, in one of the Southeast states, whose husband was kidnapped. And I think 3 years till date, governorship candidate, no word, no information, nothing. Like, so if you think of her mental health as tied to elections, that's an example. And I think the third one for me is the one that I think we need to be very careful about in defining people who have mental health, in a sense, conditions. And so that the spectrum of mental health illnesses, schizophrenia, bipolar, whatever the diagnosis might be, that affects the way people function, the way people process information, the way that they engage. When we get into that very sensitive area and how that relates to elections and giving people the power to determine how I can engage, participate, vote, diagnosis, I think there's a fine line between privacy in terms of people's, because as I say, a mental health condition is your brain having a problem, like someone who has a pacemaker in their heart. Like the fact that I have a pacemaker in my heart, or the fact that I go through dialysis, or the fact that I don't have use of my legs and I'm in a wheelchair, are different spectrums of a health, an illness or disability in a sense. But for when it comes to mental health, it's a bit more dicey. I think in my view, requires a bit more privacy. Also because of how we, as a society, people who have those challenges. So in terms of policy recommendations and engaging government on that, I just think we need to be very mindful of those definitions, especially as it relates to elections and how it can be weaponized in terms of people's abilities. And then lastly, as I have told the mental health policy team separately, I think the recommendations are a lot for an initial policy brief. And I think we need to work together to look through that to make it easier, because it's not our elections are special enough as they are. We need to make this easy to be as a conversation. So not make the policy recommendations too many, make the points of entry for government and partners relatively easy so they don't recoil, because it just seems like a lot. And an easy one that I would say should be one that we should really push some energy in, because it's not just about elections, but also about the country, is the national hotline. And I think an easy way entry for government as well is that the back end doesn't have to be staffed by government. So you basically have government serving as an interface that approves organizations that provide those types of services. And the hotline number just becomes a gateway into a call center of sorts. And so you call 118, and that call can be patched into NEEM Foundation or Aspilos Foundation, or whichever organization is able to provide those backend services. But the Federal Ministry of Health serves as a vetting agency, quote unquote, of those services. And lastly, I think we need to celebrate and find a way in celebrating and not celebrating, sorry, that's not the word I was using for, being intentional about making this part of medicine or wellness or healthcare an area of interest for students as they choose their career paths. If we're saying we don't have enough professionals in that space, then there must be some intentionality, either through offering scholarships and just making it something that people want to choose to study because they also see excuse me, a path to a career in that. And those will be my remarks. Thank you very much.
Thank you so much for that. That's the executive director of Enough is Enough. We know the type of work that Yemi and her organization has been doing in order to help make government more accessible, more inclusive, and generally more responsive to the people. So thank you so much for those great words. And I think that Yemi's words, along with Honorable Rotimi's suggestions, implore us to take a second. What we're gonna do, Yemi, is work with Enough is continue working with Enough is Enough. We have the zero draft, but we'll work in the next week to incorporate all the suggestions and then release to everybody who's registered an updated version of the policy brief. Just so because I think that we want to make it as fit for purpose as possible. So that's really good for the suggestions that you've had today, and maybe we'll get one or two more comments from the group. With that said, Yemi, please stay here. I think that some people may have questions, and any one of us, including Ikenna, Honorable Rotimi, can respond to those questions for a couple of minutes. So let's stay on stage. Elizabeth, are you available to come on video now? Okay, can you come on video? We have it. We have it. You see, you guys, she's not just a phantom voice. She actually exists here. So if you've been contacted or if you got an email from Elizabeth, there she is right now. And I'm gonna invite you guys to use your cameras or use your screenshots as we smile and acknowledge this. This will be the picture that we share on the newsletter, we share with development partners, we share out loud. So please, and please, we encourage you to tweet and all that stuff. So let's smile for the cameras. Take my own pictures. Hit the last clicks. And with that said, let's give everybody a round of applause. I hope you guys got those pictures. Thank you so much. So with that said, we're gonna allow for a couple of questions that people may have. You can come off of you can raise your hand actually, and I'll call on you. And I'm gonna start with one question to everyone that was asked by in the chat, which is, how can one support, or are there collaborative platforms for internationally trained professionals to provide training, volunteer time to support efforts within Nigerian mental health or in government, etc.? I'm a mental health professional joining in from Canada. I have my own thoughts on that. Honorable Rotimi, Ikenna, Yemi, do you guys have any reaction to that question about someone being an internationally trained mental health professional and wanting to support mental health efforts in Nigeria?
I mean, from my end, I think my comment would be connecting with you and then getting information on organizations in Nigeria that are offering services, and then finding out how you can collaborate with them. A lot of services now are being offered virtually, for example. So the fact that you're in Canada doesn't stop you from being part of a team, volunteering from a team to offer services. One, training is another angle that you could be useful if you're strong in that area. And then number 3 is being also a bridge and finding other professionals like yourself So I'm assuming that in Canada you belong to, excuse me, you belong to a society, an organization, professional body of your profession and what you do. And so within that space as well, once you've identified, and I keep mentioning NIM and Aspilos are the ones that come to mind readily. If you've spoken to, for example, those two foundations and you've been able to identify their areas of need, what you can do, you can then go back to the associations you belong to and pull more people that can volunteer and provide service. I mean, there's something to be said for cultural context. So obviously it would be people who understand the dynamics of our culture and the issues that come with that. Thank you.
Thank you. Honorable Rotimi, it sounded like you had a response to that as well.
Well, for me, yeah. Thank you very much for your enduring work. They were very, helpful, within the course of my way, but I know that they did a lot to be able to identify a few people across parties. They could, help with some sort of research and all of that, for contributing to my path. Now, in terms of, the question around, what in terms of legislation, that's a very helpful way. Other areas, jurisdiction legislation, you can share with us areas in which things from one jurisdiction to the other, because there's a local context, but as you can know what can fit into this. Always so happy to listen to you on areas, first of all, in terms of legislation and what else you think even the executive arm of government in terms of compelling them to bring some of these policies on board. Yeah.
Honorable Rotimi, I had a question for you. And like I said, if you do have a question, raise your hand or write it in the chat and we'll call on you. But the question I had for you is that you mentioned that you almost broke down during your candidacy. And one of the things that we mentioned in the policy brief was about how people always think about the issues when it comes to mental health as the voters. They don't really think about the candidates. And so my question to you is, what do you think would have been helpful for you in terms of resources and support? And then secondly, you mentioned that you talked to someone. Who was that person?
Yes.
Were they a psychiatrist or psychologist? Were they a friend? How did you make a decision about who to talk to?
There is disproportionate pressure on political actors. In the last dispensation, 100 pre-election cases, 1,800, that's 77 judges had to decide on before the elections in accordance with the Electoral Act. So you can even imagine the pressure that puts even on the judges to go through all of this, on the candidates themselves or the aspirants at that stage. And then after the election, you had 400 cases, post National Assembly election. So you can imagine there are 360 members in the House and 400 and 109 in the Senate. So cumulatively about 450 people had cases. So you were assigned an office, you resumed in an office, and 40 people lost their seats or thereabouts in the House. Don't quote me on that, but quite a number of people, at least we know in Plateau State, majority of them lost their seats because of some issues. It puts a lot of stress on you. So for me at that time, it was the fact that you are exposed. And even though, I mean, my father was my predecessor in politics and being around, he was one of my predecessors. I was born when he was in office. The point is, I've always been around politics and governance, but I wasn't prepared for the amount of invasion of yourself because you're trying to balance out issues of accessibility, issues of accountability. So over time, you find out that, look, you're simply just anybody calls you. Someone can call you that my wife is just, had a baby. I remember someone calling me at a point in time and told me all she wanted was to hear from me. She didn't want to hear sorry from anybody else. She wanted to hear from me. And I just took that call like, why is someone calling me this late? So the point is that I wasn't ready for that amount of invasion. And now, yes, I did, in answering your question directly, I did seek out, I'm not quite sure, but it was a professional that I sat down and I spoke with, and for a few weeks, we had a chat every week. I can speak about this in anywhere. For about 5 weeks or so, we had a chat going on, and I learned skills because, again, mental health, everybody has had physical ailments all their lives. Your hand hurts, and everybody has also had the mental illness to some degree. It doesn't have to be something really debilitating and breakdown. It might simply be, some stress, some anxiety. Those are things. And if you don't check it, and become a big issue. So I had to learn issues around, particularly one thing that I had was boundaries and allowing so many people access. And when they know how to manipulate these things for their own objectives, you then become vulnerable to such issues. So in answering your question directly, I spoke with a professional for about 5 minutes. We go to the church, we go to religious leaders, we go to so many other people to seek counsel. But over and above, sometimes they don't have the skill to address the issues. They don't have the proficiency. They don't have the, to help you. So increasingly, a lot of faith-based organizations are having more of such capacity, but in that particular instance, a friend of mine, and she recommended. So I spoke with someone. And back to Yemi's question, that person was actually in England. That person 5 weeks, so that tells you that about volunteering as well. Yes, there train the trainer thing to let people start to understand, this, so that we can have a more empathetic society, a kinder society that can, understand these triggers better. Yeah, so it was something that I felt, look, I'm not having all of this. You guys just shut me down. Everybody just talking and calling, and they want to blackmail you that, oh, you are not answering, you know what I mean? So everybody just talking at you. And many of it is pecuniary, many of it is around Naira and Koban. Can you blame the people? There's a lot of poverty, there's a lot of need. So you as well, they are also going through a lot of stress.
Thank you so much, sir.
And they are passing on the pressure. Yeah, absolutely. Yeah.
Thank you, sir. I think that thank you for being vulnerable enough to share, because I think your story about seeking a mental health professional and going for 5 weeks will empower some other individuals to feel like it's okay. A lot of people don't feel like it's okay. They don't want to seek out a mental health professional. They don't know where to go to. And on that bit, you guys can always contact Nigerian Mental Health. We'll give you more of our information, or reach out to myself or Elizabeth, our staff, to get resources. And we'll share some resources at the end of this conversation. We'll let one more comment or question be made because we're already running out of time. Yemi, I see your hand up.
Yes, thank you. I was just going to follow up on Mr. Rotimi's offering. Thank you again. I completely agree with Chima for being vulnerable. Do you think that an awareness of how that benefited you might be useful to your colleagues on a larger scale? And I say that to say that, as you rightly say, is one thing I say all the time. All Nigerians are traumatized. We're just all on the spectrum, and we all deal with it differently. And as you rightly said, the challenges in the country and challenges in people's different circumstances puts us at different edges at different times. But there's also kind of very limited understanding and awareness of how to get help. So for some of us, it's in our religious institutions. For some of us, it's in our friend circles. We have good friends, but there is a place for professional care. And and as Chima said it, sorry, it was just like, we talk about people who are participating in elections, but not the politicians themselves. And as if a famous phrase is said, they said, broken people break others. And so that, I don't know how, I think it would be really useful if more people in political office actually understood that manipulation or frustration or not being, I mean, you can be frustrated because you can't help. There are just too many people who need too many things, and you feel that you can't help, and that then becomes a weight on you. And then obviously it affects you, and that's what, sorry, I knew I was going somewhere where I wanted to land health, then affects your physical health. And then as we now see people, this person dropped dead, this person slumped, and all of that, that also being able to tie all of that together, if it'll be something you think, not just your colleagues in the National Assembly, but politicians generally, and how that might be structured. It might not be a comment publicly, but it might be something to take up with Chime later, that to think about that. Thank you.
Absolutely, Yemi. Thank you very much for that. And I think it's very important, to have more of these conversations. I remember when we had the induction class, when we were still in, and they tried to take us through all of this. And we actually had the National Assembly Commission Democratic. So they did quite a lot in putting an interesting faculty around preparing us for this. And you don't live with the same sort of friends that you had, because a lot of people have expectations. Anybody that is broke, because they think that you have all of it. Many people don't live with their health. I'm still in the office. This is to do. There's a lot of work, except you don't want to make a difference. It puts that pressure on you. Tomorrow I'm on the road. I think it's very important that we should have more of such, sensitization, so that people that you put the pressure on. I was saying earlier that people are going through a lot, and then the lot that they are going through, they are putting it on those, people, because, down to not just, how do I put it? We need to really rethink a lot of ill, or because he can't eat. You can understand and share and have empathy. You in under stress because he has a funeral coming up. Then we really need to rethink the amount of pressure that we put on ourselves. Because on the individual level, when you speak with someone going through shit, what really is stressing you? To have a wedding, why are you putting that pressure on yourself? So some of these are social constructs, so that, we stop carrying on it, so that we really don't know what is important. All of them have to, particularly take a lead in that, because of the influence that they have. As you are looking so gloomy and dejected because you are in debt, because you haven't paid this person, you haven't paid that person. Those issues on the communal level and the individual level, so that we don't stop with what you get to as a public servant, that you become gone ahead, that I've spent a lot more years and I've been in such platforms for sometimes, that they can make you cross, that you become unfeeling, and you'll actually, because of people in the hospital, people are saying, desperate people. Where is it? Where are the resources to be able to answer? You then develop a mechanism, a cope. Really, I don't think is somewhere anybody wants to be to, but you as well have to protect yourself.
Thank you so much, sir. Thank you
Very
so much,
important.
sir.
Yeah.
Thank you so much, sir. So what I want to do is, I think that and the important point was taken about in terms of Yemi's comment concerning this awareness to your colleagues. So we would love to work with you on that, along with the agenda that you can share with us, and incorporating your initial comments to the policy brief, and us sharing that to the audience, so everybody has that in the very near future. With that said, I want to go to next steps. I want to go to next steps so people understand where to now from here. So give me a second to do that. I think I did that. Yeah. So let me share these next step slides so people are clear about where do we go from now that we've had this conversation and we've launched this policy brief. So we have the policy brief. We have the zero draft completed. We're gonna add the comments from the Honorable Rotimi and the remaining comments from Yemi, and we're gonna share this out in the near future to all individuals. We want to make sure that we get those really key insights that came out of today, to help improve the policy brief and make sure it has the impact that we want it to have. We want to reiterate that we have a guide to manage election-related stress that was supported by LEAP Africa and the Nigerian Futures Fund. That's available on our website. That's www.nigerianmentalhealth.org. So you can go on our website, and in the tab, you'll see election-related wellness resources, and you'll be able to click on this and you can read. And so this is for not just you, but for all your colleagues or friends out there. You can tell them that this resource exists, and all they have to do is go to www.nigerianmentalhealth. So when there's electoral or political transitions, they can look at that as a resource for coping and healing. In the beginning of our conversation, right before people got there, as you entered, you learned about decriminalizing attempted suicide. We got a Mental Health Act, but it doesn't just stop there. Right now, if let's say Honorable Rotimi is upset based on what was going on and attempt suicide, instead of him being an honorable, they would put him in jail instead of giving him the support he needs. We need individuals in Nigeria to get the support and care they need. So we need to decriminalize attempted suicide. We have over 5,000 signatures already from citizens saying that Nigeria should decriminalize attempted suicide. And there's a national advocacy coalition that's been created about this. Part of the members of the coalition have advocated and engaged with the Attorney General's office, who's made a statement. We've engaged with the Minister of Health, who's made a statement against this. We have adopted a national suicide prevention policy that says we should decriminalize attempted suicide. That's been adopted by Nigeria. It says that we should decriminalize attempted suicide. We still haven't decriminalized it. So almost all apparatuses have been engaged, but we need to continue to work with the 10th Assembly because it is illegal based on criminal law, which has the mandate of the legislators to change this. So this is a huge issue. There's an international campaign to decriminalize, and we are ones leading these efforts in Nigeria. So please, I believe in the chat, we have shared. You can check our wellness guide that I just mentioned. You can sign our petition, and add your voice to making sure we decriminalize attempted suicide. And if you're not sure why we should decriminalize attempted suicide and you want more information, it will tell you in the petition, but we also have extended policy brief that describes why we should decriminalize attempted suicide, which is 20 pages of key insights, information that looks at the global horizon and sees what people are doing. Additionally, you may not know where to go to. A national hotline was mentioned in Abuja and Lagos. But if you go on our website, that's www.nigerianmentalhealth.org, we have curated a list of crisis hotlines from NGOs and from government partners. So there's only 2 government hotlines in Lagos and Abuja, but from other ones, people can reach from our Nigerian Mental Health Organization. So if you need somebody to talk to, and you don't know a psychiatrist or a therapist, or you feel like you have a challenge that it needs immediate concern, you can go to our website, engage on these critical crisis hotlines, and get the important need and help that you need. I want everybody to know that you are not alone. You have a coalition of partners like the Honorable our partners like Leap Africa, Nigerian and Nigerian Youth Futures Fund, Yaga Africa, Enough is Enough, that are working to try to enhance this space. And finally, people are talking about it. So we really want to appreciate them. Can we give all of them a round of applause? Our partners that showed up today, can we give them a virtual round of applause? Our speakers that showed up today, so people know that mental health matters and we need to incorporate it in different parts of our society. And with that, I invite you guys to follow us. If you want, we check every single message. We reach out to respond to everything, because mental health and psychosocial well-being is so important. So please, if you want to act today, not only sign our petition, but follow us, because that helps us amplify our story. I'll tell you real quick that somebody posted a story about Nigerian mental health, and the lady's husband had committed suicide. And because he posted a story, the lady asked about the organization, and now she's one of the people who are giving testimony and her lived experience and involved in advocacy just because somebody posted a story. So make sure you follow Nigerian Mental Health, get involved in what we're doing, ask us questions if you want to participate, and you can make sure you donate or volunteer. And with that, I would like to appreciate our partners today for their great work. If you registered for today, we will send you the updated policy brief in the very near future. But let's give ourselves all a round of applause. And thank you, everybody who came out today to participate in this conversation. Thank you, guys. Thank you, guys. I see people saying thank you in the chat. We really appreciate it. Thank you, Honorable, for attending to this conversation today. Your words were so valuable.
Thank you very much. It was my pleasure. I'm putting my email in there right now. Legislative agenda, and I'm also putting my email and my phone number.
Okay, so the Honorable Rotimi put his information in. You see, when he said that they're a member of the assembly, that there are people's assembly, you would never usually see that. So thank you so much. Let's give him a round of applause, because we want people like him to continue to share their lived experience and continue to be a voice on these issues. So let's give him a round of applause for doing that. And continue. Let's make sure we engage him. He talked about the agenda. He talked about the engaging with the legislators. He talked about decriminalizing attempted suicide. We will certainly take him up on that. Thank you guys all for attending today. Thank you so much.
Thank you.
Thank you, guys. Everybody have a great day.
And you too. Bye.
Bye, guys.